Hi, I'm Annie Sleece, and I'm on the staff at NAMI Delaware. Welcome to our conversation today. Today, we have three agencies we'll be talking with: JFS, or Jewish Family Services, MHA, which is Mental Health Association, and Contact Lifeline. We'll be talking with each of these agencies to discuss Mental Health Awareness Month and what their agencies do and how they might serve you and those you care about. But before we begin, I just wanted to do a quick overview of what NAMI Delaware does. First of all, NAMI stands for National Alliance on Mental Illness, and NAMI as a national organization has been working for more than 40 years. It is the largest grassroots mental health organization in the country. NAMI Delaware, obviously located in the state of Delaware, has been operating for 37 years. There is a NAMI in every state, so if you're tuned in from another state and you'd like to know about your NAMI, or if you have loved ones in another state, you can access other local NAMIs by visiting their national website at nami.org. As far as NAMI Delaware, our website is namidelaware.org, and we offer programming and support groups. We offer advocacy. We have a helpline. We also have a housing program. We do lots of trainings and presentations for the whole state of Delaware. If you are seeking private trainings for your agency, your organization, your faith community, please reach out. If you're looking for a particular class or a support group, you can find out that information on our website too. And this Saturday, we have a walk scheduled May 30th. It's a virtual walk this year. Every year we have a walk in May, but this year it will look a little different. You can learn more about the walk at our website, namidelaware.org. So before we invite our guests in, I do want to remind you one thing. You are not alone. The conversation we're having today may generate strong feelings, and we want to make sure that you can access immediate support should you need it. There are several ways you can do that, but the easiest, quickest way is to text 741-741. And this is a national crisis text line available 24 hours a day, 7 days a week, and you can connect with someone that way. There is also a local line made available very recently, the Delaware Hope Line. That information is scrolling at the bottom of the screen today too. And frankly, in our conversation, you're going to learn about other resources as well. So let's welcome our guests now, and we'll get started. Hi, everybody.
Hello.
Thanks for joining today. It's great to see you. So I think the best way to get started is just to have each of you introduce yourselves. Would anyone like to go first?
Sure, I will. Good afternoon. Thank you, NAMI family, for having us. My name is Monet. I represent Jewish Family Services, JFS. I'm the clinical manager over our community-based counseling program.
Wonderful.
My name is Tanisha Brown, and I'm from Contact Lifeline, which is a 24/7 crisis hotline. And here I am the service crisis coordinator.
Wonderful.
Thank you, Annie. I'm Natalie Klaus-Rogers, and I'm a peer educator with MHA Peer Training and Outreach Services. So there are about 10 of us on staff, and we all have lived experience with substance abuse and/or mental health issues.
Wonderful. Thank you. Well, we're so glad to have you joining us today. This is going to be such a great conversation. Those of you tuning in live, please know that you can post comments or questions into the live chat, and we'll be responding to those as they pop up. And certainly if we don't address them while we're talking toward the end, we'll make sure that we've covered everything. So let's just kind of do an overview of each of your agencies and just hear about what it is your agency does. And I know that each group does a lot, so I don't know how you can you can sum that up. But Monet, you want to go first?
Sure. So at JFS, we provide counseling and support services throughout the state to children, adolescents, adult, and older adults. I oversee the community-based program, but we also have in-office therapists that work alongside of our psychiatrists and our nurse practitioners to provide a comprehensive treatment for each individual that is seen by our clinicians. And so, yeah, that's kind of like the overview.
And that's statewide.
That is statewide.
Okay, great. And hopefully everybody's noticed too, the ticker along the bottom's got everybody's contact information. So is that the best way, Monet, for people to reach out to JFS?
Yes.
It's coming through again. You'll see it.
Yeah.
All right, good.
Oh, thanks.
All right, wonderful. So Natalie, can you tell us about MHA?
MHA is all about education, from suicide prevention to mental health first aid. We also have support groups. Right now we have virtual support groups, and some of them are kind of fun. One includes a game night and a virtual karaoke. But specifically with peer training and outreach, we train people with lived experience to mentor to other people that are earlier on in their recovery. So monthly we offer trainings for people who want to be peer recovery specialists.
And are you doing those trainings online now?
We are doing them virtually right now.
Wonderful, wonderful. And your services also are statewide, is that correct?
Correct. And I'm the point of contact for the public. My extension is 215, and I think the number is going around on the ticker.
Wonderful. Thank you, Natalie. Okay, Tanisha, how about Contact Lifeline?
Contact Lifeline, we're here 24/7 as a crisis hotline. We take phone calls from the National Suicide Prevention Line. So you could live anywhere in the world, but if you have a 302 phone number, it automatically gets routed to us. And we do get other calls from different places as well, from the NSPL. We also have sexual assault services that are available in Kent and Sussex County, which we do provide advocate and also counseling that are available to the people who call. Along with that, we take crises of all sorts that are happening with people. Our mission here is to keep people safe and alive, and to definitely contact them to relevant community resources.
Wonderful, wonderful. Well, let's direct that conversation now. Speaking of crises, I would suppose that the pandemic right now is probably elevating your calls. Would that be a good guess, Tanisha?
Very accurate. We are volunteer based, and so we have every person who answers the phone is a volunteer, and we call them listeners. And they are sitting listening, and our calls have definitely had an increase. For the month of May, today, we have 1,066 phone calls.
In the month of May. What's a typical month look like?
A typical month can get kind of close to that, maybe around about 860.
Okay.
So we're definitely seeing the increase. And just to today, up to the 27th, we've already had 23 suicide assessments. And that is a lot of the different things that is happening right now during the pandemic. From the beginning, and these calls, they begin to escalate. They can escalate pretty quickly.
Right, right. And so you mentioned that the people who are listeners for Contact Lifeline are volunteers. I would suspect there's a training involved in that. Yes,
and I'm the person who does the training. It's very intense, of course, because we're teaching people how to listen. When people call us crisis line, they want to talk. You have to be able to listen. There's a certain way that you do that.
Right, wonderful. And are you doing those trainings now during the pandemic, or are you holding off until?
We are doing the trainings because thankfully, we are a confidential location, so there's not too many people in our building. There's no more than 2 of us or 3 of us here at a time. So we've still kind of been able to interact with people. But if we ever needed to go virtual, we have the capabilities to do so.
Oh, that's great. That's great. All right. Well, let's circle around and really talk about the pandemic in a broader way for each of your agencies. So would anyone want to go next about like what's different now? What's your big challenge given the pandemic right now?
Our trainings and our virtual support groups have gotten a big response.
Okay.
And we've had to learn how to gear things towards a virtual audience. Not all of our clients or participants have access to that technology.
Sure.
So that's been a challenge for us. But if you're interested in joining our support groups, our virtual support groups, now is a great time to do it because we're getting a lot of new members. So you don't have to feel uncomfortable or like you're the only newbie, because we're having a lot of new people join us. So you're more than welcome.
Oh, that's wonderful. And they can reach out to you directly. You said what you're okay, good. Good. And you mentioned that some people don't have access. Are you finding a challenge with people not knowing about it? I mean, is that a piece of this?
Or just being a little confused by the technology. And I promise you it's easier than it seems, because I was a newbie to it too. And after a month or so, I feel like a pro. So don't let that stop there.
Yeah, I think we can all agree that
Yeah.
all of this is we've been on such a long learning curve with all of the technology involved in these experiences. But yeah, like you said, Natalie, we are all working and we're figuring it out, right?
And we have people training from their phones, so it's doable.
Oh, that's great. That's great. That's great. So how about you, Monet? What do you see for the JFS group as far as a challenge given the pandemic?
Yeah, so since the pandemic, we've also seen an increase in individuals seeking out mental health counseling as well. But the challenge comes from the mobile team that actually go out into the homes. They're not able to provide that in-home service anymore. And so we're talking about families who have struggled with children who have a difficult time regulating mood, have a difficult time managing their behavior. Parents pre-COVID had a difficult time parenting, right? And organization. And so we are seeing how this pandemic has brought about more challenges in the home. And so unfortunately, we're not able to meet the real need of the community that we serve because we have to do it virtually. But there is a flip side to that challenge. We've also seen our families really build such resiliency, right?
Yeah.
And they stand connected the best way they know how. And so we're taking it all in stride. We're all trying to meet the needs. Since the pandemic, the second week into shelter, and we launched the emotional support line to Tanisha.
That's right.
So that is slowly building. And so people are calling in. It's not a crisis line. It's just an emotional support line just to kind of dump. We have trained master level counselors that are on the line, just waiting to listen and really connect them to resources. And also we've launched virtual groups. We have this really popping, I'll say popping, right out there. We have this really popping youth teen groups for boys.
Okay.
We call it quarantine. I'm telling you, it has taken off. It has taken off.
And what are the ages? Like 13 to?
Right, ages are 14 to 17.
14 to 17, teen.
Yeah.
Teen
we
boys.
have really knowledgeable and dedicated facilitators. It has grown actually really rapidly. We also offer a virtual support group for essential workers that has also been pretty successful. I mean, all across the board, we're experiencing this pandemic, right?
Yeah,
and so JFS has had the opportunities to offer support to other community agencies that are workers that are feeling burnt out.
That's
and so
right.
Come in on their weekly or their bi-weekly staff meeting and just provide that extra support that they need. And so it has brought a lot of challenges, but like I said in the beginning, I think it also has encouraged us and strengthened us and allowed us to tap into some creativity that we may not have ever even tapped into before.
Absolutely. I love that you see this as an optimistic opportunity for growth, for change, for creativity. You know, we really do have a choice at the way that we're viewing these circumstances. And while they are absolutely challenging and they sometimes just feel overwhelming, there are so many important resources. And I'm so lucky to have you all on this call at the same time right now, because if you think about it, we have educators, we have support group facilitators, we have crisis responders, we have emotional support, we have counseling, all in this call right now. So anyone viewing this video right now has access to all of those resources right here in our little state. What a powerful opportunity. And I'm so grateful that you all are with us. You know, May, Mental Health Awareness Month, we've been working obviously all month to bring awareness to this important topic. And obviously all year, all of our agencies do that. But in the month of May, we try to even make a grander, state a grander voice about mental health awareness. And this week we focused on the theme of You Are Not Alone. And you may have heard before this call started, I actually reached out to our audience and I said, just remember, you're not alone. And we feel like that's a really important mantra to just keep repeating, to say to people and to hear it and to really believe it, right? So do each of you have any thoughts on that topic or on the way that your agency might be embracing that message?
Well, I can say for us at Contact Lifeline, we are definitely number one for all of the volunteers that have to take the phone calls. You know, Monet, I really love that your agency has the essential workers like line, because my people are essential. So we have to dig into these care practices just a little bit more because they're taking the influx of calls. And the calls that we're getting are people who are saying, I am feeling alone. I'm feeling like I can't go out. I don't know how to manage this. You have young people in the very beginning. And I say young people, I want to say maybe 17 up to maybe like 27 who were extremely struggling because now that they're in the age where, mental health is a little bit more accepted. You go to your therapist, you have all these practices that you're able to do with yourself, but everything was snatched away from you so quickly.
Suddenly.
Exactly. And they don't know how to manage. So, we have definitely been able to encourage them. You're not alone. Here are some other things. I constantly refer to MHA with the virtual groups that they have, JFS, the resources that we know that are in their area. I'm looking up NAMI in Hawaii everywhere just to be able to connect people. We wanted to work for them, and when we say, we are a crisis line, not necessarily, the house is burning, but it's like, I'm feeling uneasy and I'm not quite sure, what to do. And the other part of the You Are Not Alone is for the people who are losing people during COVID, because now how we commune together when someone passes away is totally different. So they are feeling isolated and not being able to be with their loved ones during this time. So we're constantly pushing out. We are all here together. I know this is not comfortable. This is very hard to do, but we're all going to make it. And we always let all of our callers know you can call here every single day and someone will be here to pick up this phone 24/7. And that has given them a sense of, okay, maybe I can talk to somebody and I'm not so alone.
Right. And it's so valuable. That's so important. Thank you, Tanisha.
Yeah. So we at JFS, we've adopted this slogan that we are home to help ever since the pandemic. And we really mean that. And we have been implementing new things. And my CEO, along with the entire JFS family, have been so innovative at the things that we're doing to trying to meet the needs of the community. The unemployed, those are the population that has suffered unemployment. Like Alicia said, those individuals that are just lonely. The individuals I've had the opportunity to just meet with some colleagues that tested positive and offered support. And so we're not exempt from this pandemic, right?
Yeah.
And so we all are feeling the impact of it. And although we are at a distance, although our location has changed, JFS stands by the slogan that we're home, but we're still here to help. And that's to really, really embrace.
That's a wonderful slogan. I love it.
Absolutely.
Well, MHA is still here. And you're not alone. I know that because I battle depression every day. And I have 9 other coworkers that battle mental illness and are winning. So instead of me walking in your shoes and you walking in my shoes, let's just walk together and get through this together.
Yeah, I love that. That's absolutely the truth. That's absolutely. Things just look different now, right? They just look different. And when we just need to remind ourselves. And I think it's important to, I think Tanisha, you talked about the self-care practices for your team, because we, in the roles that we're in, we're hearing a lot of stories, right? We're learning a lot of the struggles that people are experiencing. And we are, like you said, Monet, we're not exempt from feeling the struggles ourselves. So we have to remember that we're not alone either. Those tuning in.
Absolutely. I encourage them to do a lot. We have a really nice porch. And so we've kind of adopted this thing of leave it on the porch. When you leave here, you leave it on the porch because you're taking in so much of people's energy and their trauma and their grief and their loss, all of these different things. And you yourself have to take care of yourself for your friends, your family, and be there to support them. So we have this thing. You just leave it on the porch.
I love that.
If you need more, reach out to us, but we're trying to do that too.
I love that. Yeah. Leave it on the porch. We're doing a lot of Zoom calls. We're doing obviously Facebook Live. These technologies allow us to get connected, but we also need to take breaks, right? Are you all doing that? Are you all encouraging each other to just, go for a run or go for a walk at the park or those kinds of things too? We have to maintain that balance. Now that the weather's getting nicer, I think it's easier to consider that too.
Absolutely.
The self-care practices are critical.
Yeah, because even now with people being outside, seeing people with masks on, changing people ideas. So we're even talking about these basic things like this looks odd to me. How do I handle this.
Right.
You know?
Sure.
So we tell them, go outside, keep a safe distance.
Mm-hmm. Right. We were just talking about that with smiling. So when you see someone and they're wearing a mask, how can you tell if they're smiling? And so we were talking about smiling with your eyes, you know, trying to lift your eyebrows. And we as a community, we have to work together at finding ways to help each other. And even that subtle like glance at someone where you're lifting your eyebrows, that can actually be that warm, kind, you know, outreach like a smile could be, right?
Yeah,
I saw a great article where some healthcare workers are wearing pictures of themselves smiling.
That's awesome.
So even though they have a mask on, you can see a picture of them.
That's a great idea.
That's a great idea.
Yeah. You know, thinking about ideas and creativity, these are opportunities for innovation, right? And we're faced with these challenges that we would have never guessed we'd be in, but people are solving problems and they're coming up with innovative ways to overcome things and to serve others in a new way. You know, we recently had a support group where we had some people from out of state tune in because the support group was virtual and somehow they were shared the information, the post, and they signed up and they were able to join us. There are no barriers. There were no state lines. They were just part of our support group because they wanted that support. So they were capable of accessing it. So when opportunities like that come up, we almost look at this like, well, this isn't all bad. I mean, we can find the good in it, right? Are you all seeing any things like that you're like, wow, I never thought that would have happened, but here we are?
Yeah, I think just our ability to stay connected despite how isolated things are globally, right?
Yeah.
And so I find a lot of strength and power in that. And just, you know, historically, Delaware has worked in these silos. Right. And so we see them forging together now, like all, you know, communities are really partnering together and doing things to support mental health as a whole.
Sure.
And it's a beautiful thing.
It is.
Yeah. So I'm encouraged by the relationships that are being forged and the community connections and organizations that are happening because of the pandemic that we would not have really embarked upon if it wasn't for the pandemic.
Absolutely.
I'm pleased in our virtual support group, we've got a couple of caretakers that haven't come to our in-person support groups because they're caring for a loved one and they can't.
Sure.
But now that we've offered the virtual support groups, we're going to keep doing them even after this is all over.
Same here. Yeah.
It provides access to people that normally couldn't come to our in-person support groups.
Absolutely.
So,
absolutely. Yeah. We're meeting needs we didn't even realize we do. Yeah. In ways we never suspected. So while we're not happy about the pandemic, we're trying to find, you know, those silver linings, right? We're trying to find opportunities to bring joy and to serve, right? To serve. Yeah. And I think you're right, Monet, the partnerships that we've worked together we're a small state. We have agencies working side by side, but you're right. Oftentimes we are siloed. Oftentimes we don't stop to notice what our partner agencies are doing or what they're, what they're offering that might complement what we're offering. But right now, this call is an example of how we can work together to serve the need. It is not a contest. It is not a race. We are working together to serve Delawareans, and that's inspiring.
Yes.
And certainly, when the pandemic is over, we'll all be certainly grateful, right? But let's not lose that partnership. Let's not lose that collaborative spirit, because I think it's making a difference. I definitely feel it. And you know, we have to find the silver linings for sure.
I mean, I just want to say just the fact I'm deeply moved and grieved about the number of calls that Tanisha Contact Life has gotten. And so I'm already thinking like, gee, how can we help to support, you know, these frontliners and also support the community as a whole? Over 1,000 calls in the month of May.
That's
huge. And that it's huge. And so I would have never had the opportunity to know that if it wasn't for this forum. And so I thank NAMI and I thank you.
Absolutely. Absolutely.
Yeah, and like I said, we've done, we've done, 23, today's the 27th. So we've done the 23 assessments on people. So that's around about like 5, a little bit more, 5 to 6, every week. And it's just people feeling lost. And just like Natalie was saying with caretakers, you have older people was like, I can't see my grandchildren. I can't do these things. And it's like, I don't know what to do. But because we're able to connect them, when I saw the newsletter come out for MHA virtual, hey, let me tell you about this new resource that's available. Do you have a computer? Can your grandson walk you through it? Can we get on there? And they're like, you know what? I never thought of that because you never had to. I'm so loving like how we are really weaving this really good quilt of, you know, mental health. I
love that.
Really coming up with resources for everyone to be able to take a part of.
I love what you just said. If we could just quote you right now, Tanisha, we're weaving this quote, weaving this quilt of support. That's amazing. Yeah, that's exactly what we're doing. You know, it just occurred to me, we have a few more days left in the month of May, and we have events coming up. I did mention that we have our walk on Saturday, that we'd love everyone to participate just virtually. You can sign up on our website. It's really just an opportunity to bring awareness to the efforts that we're all making in regards to mental health awareness. And we also have an event tomorrow night. It's called Sharing Hope Community Conversations. And I think, Tanisha, you were part of our Sharing Hope conversation, the first one, right? Yeah. So we've had 3. So this will be the third one, I should say. So the first one was Tanisha representing providers. We had mental health providers, and we had peers, excuse me. And we had family members in yours, right? Yours was the family member peer one, right? And then we also had one with providers and faith leaders.
Yes.
So those were Facebook Live. So it was more like talking and people could listen. But the next one tomorrow night is on Zoom. So people can actually do what we're doing right now, which is just having a conversation. And that's going to be really exciting. That's at 7 p.m. tomorrow night. And the Lieutenant Governor will be doing the greeting for that. So we're very excited about offering that option too. Do you all have anything coming up that you'd like to let people know about?
Annie, I just have a question about tomorrow's event. Do we go to NAMI and we can just click on the link, or?
Yeah. Well, you'll need to, we do want you to register. Since it's Zoom, we'll send you the link for Zoom. So there's a link on our website. We also have it on our Facebook page, and I'm betting that Wesley's going to post it here somewhere. Yep. He just put it up. Isn't Wesley good? Wesley reads he literally reads our minds. He just posted the link. It's an Eventbrite forum. So you can click that, put in your email address, and we'll send you the link. That way it's private. Yeah. And it's going to be a really powerful conversation. Our moderator, Namade, I'm not sure if Namade's tuned in right now, but she supports us in so many events. I would suspect that she's either watching now or she will tune into this later. So shout out to Namade. She's awesome, and she'll be moderating that tomorrow night.
Nice. If I can just touch on some of the upcoming events that JFS has.
Yeah.
As I mentioned in the intro, we also provide support services, and that is for some of our youth. And so this summer, we're having a free summer camp for adolescents ages 14 to 21. It's going to be virtual, who have documented disabilities. So that could be an IEP, that could be a 504. So if you know of someone that could use just some extra support and do some fun things virtually, that kind of fits that category. Again, it's adolescents from 4 to 21 that have documented disabilities. We have a free virtual summer camp that JFS is hosting.
Okay, that sounds great.
That does sound great.
Anything else coming up that we should know about or give a shout out about?
A lot of our things have been canceled and can't go virtual, but
yeah,
we will definitely let all of our community partners know.
Yeah. So I know, Natalie, you mentioned mental health first aid. Mental health first aid will soon be a virtual option.
Yes.
It's not quite yet, but it will be. And both NAMI and MHA offer that training. So that's another really great opportunity for people to learn more so that they can help each other. And the idea of it is really just the concept of CPR, but it's for mental health. So the idea that you can step in and assist someone either experiencing a crisis or with an emerging concern, you can help them get connected to help.
Yeah, we just had our mindfulness event last Saturday.
Oh, wonderful.
But our virtual support groups are still going strong and all are welcome. And one of our virtual support groups is parenting during COVID-19. So all are welcome to that too.
That sounds great. Awesome. And where would people find that information? Is that just straight on your website?
Yeah, you can see our website. We have a Facebook page, or you can give us a call and we can get that information out to you.
Awesome. Awesome. That's great. Well, listen, I just want to thank all of you for being a part of this conversation. This was such a pleasure to spend some time with each of you. And please give our best to your colleagues at your respective agencies. We love and support all of you, and we're so grateful for the partnership that we've been able to build together.
Thank you.
Thank you.
Annie,
Have a great day, everybody.
you as well.
Bye-bye.
Mhm.